Hi everyone, this is Eric Miner and welcome to today's webinar of the Biomedics Academy. Today we'll be covering advanced topics. We're going to spend some time discussing different contraindications and some ways around a few of them, and then afterwards we're going to talk about some basic tips and tricks for the device and some alternative uses for the PADnet device that you may not be aware of. If you have any questions throughout the webinar, please type them into your GoToWebinar chat window and they'll be addressed at the end of the webinar. I'll also unmute everyone at the end of the call so you can ask questions directly as well if you'd like. If you think of any questions after the webinar ends, I encourage you to call the customer service number or the contact us by email. Both of those pieces of contact information are at the bottom of every slide. Diving right in, here's a list of the contraindications. You won't need to write this down. I'll email this to everyone who's attending at the end of the webinar. I did want to take a moment to go into more depth on a couple of these because they won't all prevent you from doing a PADnet study. The first one I wanted to highlight was bypass grafts. Bypass grafts, you actually can't place a cuff over the graft to get a systolic pressure, but you can still get a PVR waveform. Those are still safe. For dialysis ports, you don't want to put a cuff over that location at all, but you can still get other data. So, if the patient has a dialysis port on the right arm, and you won't want to be able to get a pressure there, but you still can get the pressure in the left arm and complete the test just like normal. For patients with lymphedema, you can often still test, but it should be avoided if the patient has excessive edema. We're going to cover open sores and ulcers and Parkinson's patients in a few slides here, so we'll leave those by and by for now. And then the last one I wanted to highlight on the list are patients with stents. Similarly to the bypass graft, if the patient has a stent, you can still get the waveforms, but you can't get systolic pressures over that spot. So, Parkinson's patients have often experienced tremors in their extremities that can disrupt the test. The test is sensitive to motion, and so those tremors can disrupt the test. If the patient is comfortable, you can simply use your free hand to gently hold the patient's extremity to minimize the shaking as much as possible so you can get the best possible testing data. If the patient's uncomfortable with that, then then simply don't perform the exam. Patients with vertigo may not be comfortable lying flat for testing. We often get questions about whether about trying to perform the test with the patient sitting in a chair, something along those lines. It is calibrated so that the patient is lying in a supine position, so we need to get as close to that as possible. A small pillow under the head sometimes alleviates the patient's vertigo. If that works, that's perfectly fine. Or alternatively, some patients have a much easier time if you slowly lower them into that position. So if you have a reclining chair and you want to gently recline them maybe over the period that you're entering the testing data, if that helps the patient, then that works as well. But when the patient's being tested, they do need to be as flat as possible to get good data. For obese patients, there may be difficulty simply because the cuffs aren't large enough. Now, what I do want to take a moment to highlight here, what you can't do is you can't take a larger cuff from a different segment and place that over a different location. For example, if you're unable to fit the calf and arm cuff around the patient's calf, you can't take the above the knee cuff and place that around the patient's calf instead and simply swap those out. The reason being is that the system is calibrated for each individual cuff for each individual segment. So that's going to throw off the test pretty dramatically. What you can do, however, is you can attach two cuffs. So using the example that I had a moment ago, if you're unable to fit the calf and arm cuff around the patient's leg, you can simply Velcro two calf and arm cuffs together and place and wrap that as one large cuff around the patient's calf. When you do that, make sure the bladder that's hooked up to the air pressure hose is located on top or the anterior part of the patient's limb. For patients with ulcers or open sores, this is the only situation in which you're going to want to have something in between the cuff and the patient's skin. So it's pretty simple. If you have Coban wrap handy, that works perfectly fine, or Saran wrap to keep the cuff and keep the cuff separated from the open sore there. And that pressures and PVRs can be obtained just like normal in those situations. The most common PADnet test actually stops at the ankle. That's the CPT code 93923. But sometimes you're going to want to get some toe pressures anyway, just to examine blood flow into the patient's feet. Podiatrists often want toe pressures because that's their area of specialty. Additionally, if you're in a situation where you can't get ankle pressures, you can take the toe pressures instead, so you can both bill for a full study. If the patient has ulcers on their toes, or if they're a surgical candidate, but you need to check blood flow in and out of the patient's foot, or simply because the doctor requests it, those are all good reasons to get toe pressures or toe waveforms using the toe cuffs. I also want to take a moment to highlight that it can sometimes be very difficult, especially with diabetic patients, to get a toe pressure or a toe PVR in the patient's toes if they're cold. So if you know that you're going to need toe pressures or toe PVRs, take action at the beginning of the study to keep the patient's feet warm. If the patient has loose socks, you can just leave those on until you get to the point of the study where you do need to, place things on the patient's feet. Or some offices keep a towel handy or a light blanket just to keep the toes sort of out of the chilly air while you perform the rest of the study. You do have the ability to customize our protocol. If, for example, you never or rarely ever perform toe pressures, it can be a little aggravating if the system prompts you to do that every time. By the same token, if you never perform a post-exercise study, you can do that as well. Just give me just a moment here. I will get back to where we were in the slides. And then I'll show you in the PADnet testing software where you can customize the protocol. Okay, so I've logged into the PADnet testing software. What you're going to want to do is you're going to want to look up in admin, office settings, and then move over to test sites. In test sites, this is the list of operations, the list of actual testing sites that the device will prompt you for. Now, obviously, you don't need to. You can skip any portions of the test that you're unable to perform. So for example, in this situation, maybe you never perform toe pressures, you can check or uncheck, you can uncheck those. Maybe you want to make sure the toe pressures are there every time. All of that can be done here. Same by the same token, you can add or remove post-exercise testing, or taking segmental pressures above the knee or at the calf, which aren't usually performed, but can sometimes have diagnostic value if the doctor asks for it. Sometimes we get questions about whether or not PADnet can be used as a screening device, and the answer is yes. Now, the screening isn't by itself reimbursable, but if you perform what you're going to be doing is you're going to be going into the software exactly like you're going to test a full test on the patient, but rather than performing the full test, you'll just perform the ankle waveforms. Now, if those ankle waveforms are abnormal, they can be used as a primary indication for a full study. So if you perform the ankle waveforms, they're abnormal, that's then justification to perform the entire test. You can go back and start over the test from the beginning. Previously, we recommended using pulmonary vascular disease unspecified, that's ICD-10 code I-73.9, but based on the changes about how the Medicare is handling those ICD-10 codes starting October the 1st, we've changed our recommendation to unspecified arteriosclerosis of native arteries of extremities for right, left, and bilateral. That's I-70.201, 202, and 203 respectively. Like I mentioned a moment ago, normally this the test that's performed with the PADnet device is the full arterial study, 93923. It does have a slightly higher reimbursement rate than the limited arterial study, 93922. For the complete study, you're getting pressures at the arms and the ankles, and then waveforms above the knee, at the calf, and at the ankle location. For the limited study, you're just getting pressure at the arms and ankles, and then waveforms at the ankles. You might want to perform this study if you are if you're in a limited if you are in a time crunch. It is a slightly faster study, or in some cases, actually, some LCDs actually don't allow certain doctors' offices to perform the full arterial study. Some podiatrist offices are barred from doing 93923 and need to perform 93922 instead. For the post-exercise study, it normally reimburses at about $150. It's normally indicated in a situation where the patient has intermittent claudication, pain while walking that only occurs during exercise and it's not resting pain. It's very similar to a full. You perform the full arterial study first, and then you have the patient walk on a treadmill at 2 miles per hour at a 5% incline for 5 minutes or until onset of symptoms. I'll show you what that looks like in the testing software here. I'm going to make sure that our post-exercise study is turned on. So if you have completed a full study, you will, let's see if I can get it to come up for us here. Okay, so you move into the post-exercise study. Every time it will every time you select a post-exercise study, it gives you an error message. Once post-exercise test results have been saved, you will no longer be able to access initial test sites. So that's just a warning. If for example, your above-the-knee PVR didn't look very good for whatever reason, maybe the patient moved or squirmed a little bit in there, you're going to want to go back and do that waveform. You're going to redo that waveform before you move on to the post-exercise study. Because once you move to the post-exercise study, you won't be able to go back and redo that waveform. So this is the exercise screen. You simply start the exercise while the patient's walking on that treadmill. The timer up on top will start counting up to the 5-minute mark, and then there's a section here for notes. So if the patient experiences claudication, say 3 minutes of the way through the test, rather than allowing it to go to the full 5, you will stop it at 3 minutes and then put in the notes why the test was stopped, and then you're basically going to redo that study and take different segmental pressures at 2 minutes, at 2-minute increments, until the patient returns to baseline. In some situations, you're going to want to differentiate between the two main veins in the ankles, the anterior tibial vein, or the AT, and the posterior tibial vein, or the PT. The system does support this measurement, although it only records the pressures, the Doppler pressures, and not the Doppler waveforms. To do this, you'll need to have your own USB-connected Doppler device and a foot pedal. To enable the Doppler pressures, you'll need to navigate to the Office Settings pop-up. We were there just a moment ago. I'll show you that screen again here. Oop, not where we want to be. Just like before, Admin, Office Settings. Then it brings up the screen. In this case, you want the full. In this case, you want the first tab, and then it's the Use Doppler-enabled pressures right here. Once you've done that, you'll be able to see. I'm not going to do it in my software because I don't have a Doppler enabled. But once you do that, rather than the normal, the typical PADman, it's going to show you two separate red boxes at the ankle level. One of them is labeled AT, that's anterior tibial, and then the other one's labeled PT, that's posterior tibial. We do get some questions about cuff care. Cuffs have a normal lifespan of about 3 to 5 years, and the best way to make sure they get to that point is to just keep the cuffs clean with some mild soap and water. The one thing I do want to highlight is some offices have alcohol swabs handy or wipe them down with alcohol. That does cause the cuffs to wear out a little bit sooner, causes them to dry out and crack. So I would recommend, again, using mild soap and water and not the alcohol. You can take and transfer images as part of the report. Often that's insurance cards like you can see on this slide here, but if you think the reading physician might benefit from a picture of the patient, maybe they have edema in their leg, maybe they have an open ulcer in their foot, you can take those pictures and attach those to the report as well. If you have any questions on that front, and I encourage you to reach out to customer service so they can help you get that set up. We're nearing the end of the webinar, so I did want to take a few moments here to highlight a couple of special offers that Biomedics is offering right now. The first one is certification through the American College of Foot and Ankle Orthopedic Medicine. Most states and most insurance companies have a requirement that technicians performing the test are certified through a nationally recognized body. We can connect you with the certification through American College of Foot and Ankle Orthopedic Medicine, that's ACFAOM. And rather than you paying for the certification, we're happy to do that under certain situations. They will need training. Now you can purchase training through Biomedics, but normally what we recommend is attending the webinars like the one today. That will work fine, or they can review the webinar videos on our YouTube channel. After the training, the technician will need to pass an online exam. That's 30 questions. Once they've passed it, they're considered provisionally certified under the supervision of the doctor. In the first 90 days, the technician will need to perform 30 studies and then submit them. Those need to be real studies on real patients. And after that point, contact us. We'll review those tests for competency. Make sure they're good quality tests, and issue you that 12-month certification. If the technologist keeps up with that level of quality, they're still sending out good quality tests, and that level of volume, they're still testing about 10 tests a month. Contact us when the renewal is due, and we'll pay for that renewal of the certification as well. And then I wanted to take a moment to highlight one of a service that's offered to everyone with a current PADnet contract. This is a free service that's part of your PADnet contract. At your invitation, we can remote into your EMR and query to find patients with primary indications for both PAD and CVI studies. We'll filter that list of indicated patients against the tests that you've already performed and then provide you with that clean list and a script so you can easily contact those patients. If we find at least 100 patients that are indicated for a study, just to show support for you and your medical staff, we'll provide you with a free month of service at the same level you've already purchased. So I did want to take a moment here to open it up for questions. I did get a couple of questions in the chat window, so I'm going to go through those first. The first question is actually about our contraindications slide that we talked about in the, earlier here. The question is, why can you get waveforms but not systolic pressures over a graft? Now it's the same for stents. You can get the waveforms but not the systolic pressures. And the reason why the waveforms are okay but not the pressures is simply because the level of pressure that the cuff goes up to. For a pressure usually at the arm or the ankle, the cuff tightens to 200 millimeters of mercury. For a waveform, it's only about 60 or 65, so it's dramatically lower. That's the reason why it's safe to do the waveforms, but not to do the pressures above the stents or the grafts. That's a good question. I appreciate that. Someone had their PADnet software open during the webinar, and they tried to go in and alter the testing protocol, like I indicated, and they weren't able to. The reason for that, most of the time when Biomedics sets up a user profile, we give everybody admin privileges so they can make changes to that testing protocol, but it doesn't happen in every case. So if you're unable to make changes to the testing protocol, what that means is you don't have privileges to do so. If you give us a call at Biomedics customer support, we're happy to add those privileges for you. Just give us a call. I have a question about mastectomies, actually, and post-radial mastectomies are contraindicated, just like some of our other contraindications. Taking a blood pressure on the same side as a mastectomy is contraindicated. So, for example, if the patient had a right mastectomy, you can't get a pressure on the right arm, but you can still get the pressure on the left arm to perform the test. What the question is actually about, though, is the best way to skip that pressure when the system prompts you to do it. If you noticed earlier in the exam, what I did was I typed in a manual pressure. So you just go into the pressure. Oh, I'm not allowed to alter this one, actually. Go into another one here. And you'll type in, you click on the pressure section for the right arm. I've moved this one to post-exercise as well. Just a moment here. Let's try this one. And then you're unable to get a pressure on the right arm. What you'll do here is you'll simply type in a manual pressure of 201. Make sure if you do that, and then we'll just leave that one there. Make sure if you do that, you leave a note for the interpreting physician. The system, like I mentioned a moment ago, only pressurizes to a maximum of 200 millimeters of mercury. So pressure of 201 should indicate to everyone involved that that's not a pressure the system actually took, which is why that's my recommendation. But you're going to want to make sure you include that in the notes as well. Someone with, let's see, the question is about the Doppler-enabled pressures here as well. Just a moment while I get to the correct slide. So you'll notice on this screen, the questioner noticed here that the AT is marked in parentheses DP. This vein has a couple of different names. It's usually called the anterior tibial, but in some cases it's called the dorsalis pedis as well. So that's what the DP is for. It's for dorsalis pedis, which is just another name for the same vein. Okay, that seems to be the end of our. It seems to be the end of our webinar, of our questions here. I'm just going to take a moment to open it up for anybody else that wants to ask me questions directly. Does anybody have any other questions for me that they'd like to ask? Okay, since there don't seem to be any other questions, I'm going to let everyone go. I appreciate you for attending the webinar. I hope you have a nice rest of your day and a nice weekend as well.